My mum was my best friend. She was a northern lass, born in Scarbrough, trained to be a child nurse, had 3 children that she loved, a husband that she adored. She put everything into us, everything that she could, and sacrificed a lot for other people. She had previously had breast cancer and it had returned, and she also had secondaries which were in her lungs. She collapsed several times and she was finally admitted. The care that Mum received on the whole was absolutely outstanding. But there were times and there are things that we need to look at.
One of our trust priorities is for patients to live well and to die well. There are lots of occasions where our patients and their loved ones have a really good experience at the end of life, but sadly we don't always get it right. And because it is so important, the Trust felt that we needed to do something about it. So we've launched the Autumn Project to empower and equip our staff with confidence to really improve the quality of care for patients and their loved ones as they spend their last days together. We recognise that sometimes there is variation between wards and the support that we offer. So the Autumn Project is to help us to provide consistency of care across the wards, and it's an initiative that's being led by our specialist palliative care team.
What Mum had always wanted, and it was really important to her, was to pass away in her own bungalow, her own bed. The nursing staff on that ward made her feel safe, and she changed her mind and she said, I'd like to stay here, I want to end my days here.
I think the staff often find communication difficult because we don't know the response we're going to get from patients and relatives. So communication skills. Often when we're having difficult conversations, because we don't know the response, we can avoid these conversations. Your tone of voice is very important. Actually, what research shows is that patients and relatives often want to have these difficult conversations. As a trust, we're offering communication skills to all levels of staff, right from a bite size right up to a 2-day course. Silence is so effective. When I say everybody, I mean right from porters, housekeepers, nurses on the ward, doctors. How can you show somebody you've got the time? The way we communicate is what people will remember, and it's what makes the difference.
Good communication enables you to have those conversations about people's preferences and wishes and how you can best achieve them.
One day a doctor came to us and said that her infection marker had dropped and she needed to be rehabilitated in another hospital. She was just so afraid. It was as if somebody had just pulled away the rug from underneath her. She saw her pathway and then it was gone. Until one of the nurses really listened. She heard the fear in my voice and she heard the fear in Mum's voice, and she listened to what Mum wanted, and that made such a difference. It took away all her anxieties and she said, yeah, you can stay.
We had a patient a few weeks ago that really wanted to be married because she wanted the same last name as her now husband. With us and the bereavement team, we moved mountains to actually bring that together, and we got donated flowers from the local supermarket, we had a cake made, we had decorations, and even though it wasn't in a church, we made it as good as we could make it, and actually that made it even more special. When we look at bringing pets into the hospital environment, it actually makes this feel more normal, it makes it feel like home. Having a dog can actually really provide a degree of calm, normality in a very abnormal situation, and that's massive that you can achieve that for somebody. One of the things that we need to ask is about people's spirituality and faith at this time in their lives. This might be really important to them, or it might not be, but we need to ask that question, and we can work very closely with the chaplaincy team around that and actually help facilitate whatever spiritual or faith needs that they may have.
It's really important to make sure that whatever somebody asks for, in whatever shape or form, that we try and make that happen.
Care of patients at the end of life is a real privilege, but it can be a challenge for patients having repeatedly difficult conversations. So the autumn leaf is a symbol that, with the patient's consent or the loved one's consent, can be placed above the bed or on the bedroom door, and it's visibly a reminder to staff to keep noise levels down, that sensitive conversations are taking place, and that the patient and the relatives may well need additional support.
Initially, when we meet a patient for the first time, they can be having quite a lot of acute treatment, drip stands, a lot of heart monitors, they could have fluids running, oxygen, phlebotomists wanting blood tests off them. Once that decision has been made that this patient is for no longer active treatment and that we're aiming for comfort only, we would try and make the environment better so it's not as clinical. Removing cannulas that they have in their arms, stopping machines bleeping all the time by pulling a curtain round and using the identifier of the autumn leaf, just to make people aware that actually this is a patient coming towards the end of their life. We want people to recognise that actually this family and patient are going through a very tough time and they may need a bit more extra care.
We were close to the end, and one day the most lovely lady came to me, one of the cleaners, and said, "Annie, I've just heard there's a lady discharging herself from one of the side rooms that may be becoming available." And away we went into the room on our own, the private room.
Side rooms are always possible when someone's nearing the end of life. They are needed for other reasons within the hospital. The Trust is looking into some solid screens that we can place around a bedside that's got scenery on, and it provides a lot more privacy as well. The Trust is also looking at autumn rooms, a specialised room for someone who is nearing end of life. We won't always be able to guarantee these rooms, but they are looking at being less of a clinical setting compared to a hospital side room, much more nicer lighting, nicer decorating, artwork, facilities for relatives such as tea and coffee making facilities, and a much more private place for patients and relatives.
I came in to see her one day when she was able to talk, and she said, "Do you see that man over there?" And I said, "Yes, Mum, do you mean the nurse?" And he was like, "Yeah, that man." And I said, "Yeah, what about him?" And she said, "He's the only man I've ever let pull up my pants." And it really made me laugh, but do you know what? There's something underneath that says that male nurse made her feel so dignified and provided the privacy she needed to pull up her pants. And that's wonderful.
Everyone's dignity is different. Some people may feel more dignified ensuring that the teeth are in when they're nearing the end of life. Other people may find having their own clothes on is more dignifying for them. Everyone's dignity is very different, and we have to make sure we look at that person and provide what is right for them.
It's really important to think about relatives as well as patients. Try to let them just concentrate on their relative, so they don't have to worry about anything else. They just concentrate on that relative and we take that pressure off them. Relatives really do appreciate it. They appreciate the time I take to just step out of my housekeeping role. Just take the time to ask them how they are, ask if they want a cup of tea, need a box of tissues, if they want to have a chat, or if they just need a 5-minute break. Then if they'd like me to sit with their relative while they went to gather themselves and then come back onto the ward.
The two nurses were chatting with me, and I just had this overwhelming sense and presence that my dad, who passed 17 years ago, had come into the room. And I just said to the girls, "Stop, my dad's here. I feel my dad's here." And I bent down by Mum and I looked at her and I said, "Mum, Dad's come for you." She opened her eyes. She had one little tear. The sisters came in. I said, "It's okay. She's going." And I just said, "Go to Dad." And she did. she went how she wanted to go. She chose when to go. And it was the most beautiful, beautiful thing.
End-of-life care doesn't end when the person dies. So it's really important when that person has died that you take time to spend with that family, allow them to have time to say goodbye to their loved one, allow them to have time to be able to speak and say the things they want to say. What must it feel like to walk off this ward alone? Can you afford 2 more minutes just to walk that relative off the ward? You will make that huge difference at that very difficult time in their lives.
The Autumn Project is a really important initiative for the Trust that we've committed to. We want to make a difference. We want to provide consistent, high quality care to improve communication and support for patients and their loved ones at the end of life.
Thank you for the care that you are planning to deliver and have delivered. And don't forget, you will get that support from this training, but also from your colleagues. Go out there and make a difference. End-of-life care is everyone's business. We have an important responsibility. Remember, you will remain in the memory of those that live on. We have one chance to get this right.
The impact that people have in the last stages of someone's life, in enabling them to make choices, in enabling them to feel safe, in enabling them to be at peace and to have respect and dignity. It's huge. It's the last thing they have. And people that are here now make a difference, a huge difference to what really matters.